Joining us now is Marci Gray to speak about how we can effectively support someone going through addiction and make sure we don't lose track of our own mental health in the process, because that's really the hard part. Marci, how do people like Lorraine's son become addicted, and are there warning signs to look out for?
Absolutely. So first of all, I want to thank Lorraine for sharing her story. It is very difficult to share, and it's helpful for so many families and so many people that are out there that are experiencing this. And so there are warning signs, there are some things to look out for. So some of them might be, you're starting to see the lying, you're starting to see the stealing, you're starting to see a change in their behaviors, maybe a change in their weight, a change in their energy level. So you might be seeing a little bit of a difference in their sleep and the things that they do, and maybe they're changing in terms of their social network. In terms of how one becomes addicted, so there can be so many different factors that can lead to that. They could just start the addiction, start using substances because it's a social thing that they're doing. Or it could be in response to mental health condition, or it could be because of a trauma that has happened in their life. So there's so many ways in which it can start. So Lorraine, maybe you could share a little bit about how it started for your son.
I think we can narrow it down to trauma. And, quite a few years ago when he was a teenager, and I think that is really what we can really narrow it right back to, that trauma. And I won't go into what happened, but I think it was definitely the trigger and the setting that he was in and the situation that he was in.
Now, what can someone who is supporting someone with addiction do? Because we hear Lorraine, we hear Oscar, our hearts are just pouring for them. What can they do to support this?
So there are resources that are out there. There are some resources for families. So you do want to, sometimes the first thing you want to do is, if that person's willing to even go to your family doctor to start to have the conversation about what resources are in your community. There are crisis lines that are helpful that can also give you some resources. There are addictions and mental health hospitals that can be in your area that you may want to check out. So there's different resources, and there's a lot of community mental health resources as well. But one of the biggest things is that they do need to be ready for that support. They do need to be ready for change, and so that's one of the things that we look at, is how ready are they for the change. And they really have to be ready in order for this to be lasting change.
And that's on them, unfortunately. There's nothing you can do to speed that along. So what we can do, though, is to help the folks like Lorraine and Oscar, the families that are out there that are dealing with this. Now, are there support groups or services for those who are supporting people with addiction?
There are some support groups that are out there, so you do want to check again some of your local listings. I know CMHA is all across Canada, and they tend to have some groups for families as well, as some of the mental health and addictions hospitals will have some groups and support. And you do want to look for that support. One of the biggest things you want to do is support yourself, because it can be consuming, and you want to help yourself through that time and look after your own mental health through that time that you're supporting someone else with addiction.
Would it be worth trying to meet up with other families who are going through the same sort of thing? Sometimes it's good to talk to somebody who's going through it, because you don't feel that other people understand you, So it's hard to actually say that.
It's so true. So there are meetups that people create, and so that might be a meetup that you want to create, with families who are supporting someone with an addiction. That is a great idea, that you create those. Of course, when you have a formal setting, you do have the professional support and the professional help. But if you do have a situation like that where you're doing a meetup, you do want to be careful with that as well, just to be able to support one another. But if you can have a professional also join you in that, that would be absolutely fantastic as well.
Mm-hmm. Lorraine, how does it make you feel that you just think people just don't get it?
Well, you sort of feel that you don't want to be a burden on anybody, and because we're fighting for resources for an adult, it's a little bit harder. If he was under adult, if he was a sort of a teenager, it's easier. But as an adult, you don't really have a lot of you don't really have a lot of comeback. I wasn't entitled to have an opinion at the hospital. I wasn't allowed to find out information. So it's not always easy. And so you kind of feel that disconnect, and you lose control, I suppose. And as a mother, that's one of the things that you like to have, is control over your family.
And people outside of the group of people that know about a situation like that, they can't begin to understand. So you begin to tell them about how it works. And in the case of myself, people wondered why I wasn't acting as myself. You know, I'm going to school and acting as though everything is normal, but then I go home and, you know, there's just a bunch of verbal abuse. It's a difficult situation to come home to. And all of a sudden you start losing yourself. And people don't understand what it's like if they haven't had close experiences with situations like that. Right, so you tell them how it's going and how this person is struggling with mental health and addiction, and they come up with easy responses. You know, how easy theoretically it would be to get them help, but it's not, is it?
There's nothing easy about it. We can all see that. There is absolutely nothing easy about it. It is layered, it is deep, and it is complex. So I want to say a big thank you to Marci, a big thank you to Lorraine and to Oscar for all of this honesty. You're helping people today.